don't know me. Probably never will.
But I need you to do something for me.
Something that could literally
Change everything.
You'll never get a thank you card.
And yet, I need you to do it.
And if that weren't enough, I need you to do it as soon as you are able to.
If you do this for me,
I'll do it for you.
And for every single person you love.
Deal?
This is our shot to leave COVID behind.
Good afternoon and welcome to today's breakout session entitled Infant and Maternal Wellness. Our panelists that are with us today is Ebony Tuzon. Also joining her is Alex Miller. Now at this time, ladies and gentlemen, please welcome to the virtual stage, Miss Ebony Tuzon.
Good afternoon, everyone. Thank you for that introduction. I've been working with Bright Beginnings going on 6 years. Next week will actually make my 6-year mark at Bright Beginnings. A little bit about my background. I studied child and adolescent studies in the hopes of being an educator, but then I was kind of semi-forced into the social work, family services field. I started off in the classroom, but then quickly moved to do the groundwork in the city as a home visitor. And then I became the home visiting manager at Bright Beginnings. And then knowing that it's more of an issue in the city around infant mortality, we decided to enhance our program and go in a direction where we are really making infant and maternal wellness our focus. So now my title reflects Infant and Maternal Wellness Manager. Here on this panel and session, I have my wonderful colleague, Alex, and I'll let her introduce herself.
Hi everyone, I'm Alex Miller. I am the trauma specialist here at Bright Beginnings. I'm really new to Bright Beginnings, but I am not new to this work. I got started as an art therapist in New York City and worked with at-risk families, homeless families in New York City. So I'm very familiar with home-based work. And after that, I was working in domestic violence services, of which I have over 6 years experience. So it's really interesting to be a part of this and talk about the trauma that birthing people have, coming from this work to be able to connect with families when they're homeless and having babies, if they've been sexually assaulted and are trying to have their assaulter's baby, or just helping families arrange childcare so that they can have their babies, and being a part of the family when they bring them home or bring them back to shelter, and making sure that they have the supports to keep the children safe and healthy. So I'm really excited for us to share our program with you today.
Thank you, Alex. So a little bit background about Bright Beginnings. We're a nonprofit, housed in Washington, D.C. For those who are familiar with Washington, D.C., we, for many years, was housed in Northwest D.C. In a little school called the Perry Center. And when we came about, our mission was to focus on the homeless population. And so I'll admit, going into this line of work, what I deem to be homeless is not exactly what many might think that looks like. So it's not just someone that you might see on the street without actual shelter, but it looks so many different ways. And so how we define homelessness is just families who name are not on a lease or doubling up or staying with someone, or just don't have housing at all. And so many of our referrals come from Virginia Williams. So With working with homeless children and families, we provide high quality childcare free all the way up to pre-K 4, starting at age 6 weeks in a center. And then we also have a home visiting program working with prenatal moms and children under the age of 3. So more background, Bright Beginners' mission is we're dedicated to meeting the immediate needs of children and families that are experiencing homelessness and housing instability. And we do that 3 ways. We provide children with safe and nurturing learning environments. We make sure that they are kindergarten ready and ready to learn. And then also supporting parents stabilize their lives and ultimately become self-sufficient. They can go to the next slide. The way we do that is through a 2-generational approach. So we look at things as a holistic way of serving our families. 1, providing early childhood education and supporting children's development. 2, connecting parents with post-secondary education and employment pathways. 3, building economic assets. 4, supporting health and well-being. And 5, helping families accrue social capital. Here you'll see some of the ways we do that. So an initiative that Bright Beginnings adapted a few years ago is fairly new, but is definitely done dynamic things with our families. We use something called the self-sufficiency matrix. So this matrix is comprised of 17 domains in which all of those employees that work with families one-on-one in our organization, whether that be a home visitor, a therapist, someone in health services, a family advocate, we are all able to give input and score our families across these 17 domains, which ultimately land them in one of 4 cohorts: crisis, vulnerable, stable, and self-sufficient. You'll see here that in our crisis domains, we score families in housing, income, safety, childcare, food access, mental health. Up the ladder, we score families in vulnerable services like legal services. We score and assess their parenting skills and substance abuse resources, and stable career resiliency, education and life skills, and then self-sufficient employment stability, physical health, support system, and transportation. So what this looks like in our organization, in real time, we have a database where, depending on the need of the family in that moment, whenever a social worker, home visitor, or family advocate checks in with a family in real time based on the need, these scores and numbers are aggregated so that when we pull a report at the end of what we call cycles at our organization, we are able to see where the family has progressed, and in some cases where they might have regressed, and then that allows us to figure out as a team how to best support this family. So the great thing about Bright Beginners and the great thing about this matrix is that the help and the assistance for our family is definitely individualized. And we do that purposely so that our families don't just seem like a number, or that we're pushing paper, or they're just someone in the collective. But we do, and we are very intentional on the programming that we offer, the supports that we offer in that way, because our programming, we feel is best to be implemented through cohorts. We know that we found success rates through our programs, and even families even been open to participate. Participation is higher when our programming is specific to the needs of the families and specific to whatever cohort that they're currently landing in. So this is a great way that we assess our families. We can go to the next slide.
So for Bright Beginnings trauma-informed approach, we also incorporate the 2-gen into our programming. So I'm trying to build a program where we're inviting parents and children to participate in program activities together by using art therapy or play therapy. One group we did recently was to make glitter jars. So not only do I get to send a vial of glitter into families' homes, but I also get to sneak in lessons about mindfulness, provide some psychoeducation to families, and really reduce the barrier to engaging in mental health services. We are trying to be culturally responsive. That's the buzzword of the day, and respect each family's experiences. I've seen a lot of extended families and the community here at Bright Beginnings. It's not just moms picking up. We have moms, we have a lot of dads involved in our program, aunts, uncles, grandparents. So just understanding that each family is going to be unique. And with that, understanding each family's connection to mental health is going to be unique. So people of color don't always express, oh, I'm depressed. You know, we have to be sensitive to that language, and it may come out as, I'm just not feeling myself right now, or I'm having a lot of headaches. So just being aware of language like that and what to look for when you're assessing for any trauma or mental health. We use a strength-based perspective, working with families where they're at and trying to build on their strengths. We had an example of a dad who came in and we were trying to push him towards construction jobs. That's what referrals we had open. He's like, no, I really want to be in an office. Those are where my skills at. So just really working with families to understand where they're at is going to make more successful outcomes in the long term. And then early intervention is key. I am part of the multidisciplinary team. We also have speech therapists and occupational therapists that work with our families on site. And we have a few mental health consultants that also work with us through partnerships in the community. So these services are available to families by being participants in our program. And then if they need extra services, we can work with parent consent to make that happen. But we believe that, you know, stress, trauma, being in Southeast DC, there's a lot of community violence and our families are exposed to that. So that can appear kids not ready to learn, kids not ready to engage in kindergarten. They can't sit still. And so really working to get early intervention services in place to rule that out and get them ready for kindergarten. So back to you, Ebony, next slide, please.
So the curriculum that we use in our home visiting program is called Parents as Teachers. 6 weeks to 3 years old, and it also has an additional prenatal portion to the curriculum. And so this is the curriculum carried out by the home visitors, which they go into the field once a week and provide a 90-minute visit. Being a part of the home-based program allows you to network, to receive resources and be aware of resources. Child screenings are happening. So the home visitors are completing ASQs, ASQ3s, and Brigant screenings for our children. Bi-monthly socializations, which basically are group connections, opportunities for children and their parents to interact with other families in the community that are attached to our home-based program. And then Lena is fairly new as well. It's an initiative we took on to bridge the vocabulary gap between our Black and Brown children and their counterparts. So this is a great program that we are advertising here at Bright Beginnings. Let's say if for whatever reason, space for full-time free quality child care is not available at the time. The home-based program is just as great as a model to be a part of, so that families and children, they're getting still the education that they need. So what we noticed, many families who do not have childcare, a lot of times they're just at home waiting for childcare to come. When we are letting these families know that, hey, in the meantime, for once a week, for 90 minutes, you can get all of these resources. You can get the Parents as Teachers curriculum. That curriculum teaches the parents to be the child's first teacher. It's individualized and it's by age, and it takes into account the scores from their developmental screening. So the lesson plans are individualized. So the child that might be 21 months are not getting the same thing as a 18-month. It's really individualized, and it's a great program to be a part of. It says here 6 weeks to 3 years old. I want to emphasize that it says that because that is where our screenings begin at 6 weeks, but not our brigades. I want to also add that we do have the prenatal portion. So the great thing about the Parents as Teachers curriculum is that the prenatal section allows the home visitor to do activities even with the mom while she's expecting, helping the mom bond with the baby and learn about things that's going on with her body. So this is the curriculum that we are currently using, and we're looking to also adapt Healthy Families America in the future. Next slide. I kind of touched on this. So group connections, bi-monthly socializations, again, opportunity because the children in the home-based program, they're not around children unless maybe they have family members or other siblings, but this is definitely the opportunity for children to engage with other children. And also the parents. We notice we get better outcome when certain connections are made between parent to parent. So they kind of look forward to meeting up bi-weekly at the socializations where they are not only being able to do activities with their child and being around other people, but they're also able to receive other resources. We usually have like a key speaker that come in or a certain hot topic that's relevant to whatever's going on in the world right now. And then just a boatload of resources are given at each of these socializations. Next slide.
And to support staff mitigate the symptoms of vicarious trauma, compassion fatigue, and reduce burnout, Bright Beginnings also offers staff support groups. So I help facilitate these. The wellness cohorts that we have right now is through Every Mind, and that's a grant partnership that we have that offers a monthly support group to a small group of our staff. We partner with the Early Childhood Innovation Network through a grant from Washington Area Women Foundation. And that's a really unique program that is being implemented across the area here. And we have one cohort who's been with us for the last 2 years. So we were able to offer this cohort to our teachers, and now I am facilitating it in the second year. So it's a model where I'm being trained with our second group, which includes some of Ebony's team. So we're making sure that this is available for our home-based team as well as our staff and teachers. And then additional supports, I'm available to provide trauma-informed professional development training, and then work with all of our home-based team and teachers for consultations and strategies. So I'm a resource not only to the children, but the parents and staff as well. Next slide.
Care team, I'm gonna kind of go back to when I spoke about the scoring of our self-sufficiency matrix. This here is a quick live snapshot of what that looks like. You will see numbers highlighted. You'll see some red arrows and some green arrows, red showing where families might have decreased in score, in green where they might have increased. You see here the 17 domains listed. And the families, of course, the names that aren't shown. This is what it looks like when we come to care team. Care team is comprised of home visitors, family advocates, the family advocate, the managers, myself, Alex is on that, and most of the people that are working directly with the families. This happens once a week where we are able to assess the family scores individually. We do it by priority of where they land. And most times we start with those families that are still or soon to be in crisis. And then we come together for case management, figure out an action plan, the next steps, and then revisit that family in about 2 weeks later to see if they had any growth or change. Next slide. Kind of touch base on this for screenings and support. So again, we do the ASQs and the Brigants. We also do hearing and vision screens, medical and dental screens. I spoke about the developmental screening. Speech and language therapy is offered, occupational therapy, trauma therapy, and nutrition supports. Next slide. Again, Lena, the initiative that we have to closing a vocabulary gap. Here you'll see a snapshot and what it looks like. It's a vest that our children in the center, we have this for our infant classrooms all the way to our pre-K classrooms. And what it is it's a listening device which records the conversational turns between child and adult. And vice versa. So what it does is it doesn't necessarily record the conversation, more so the voice waves. So the amount of times children attempted to either babble, coo, or speak to an adult, and how many times the children the children have been spoke to by an adult. These recordings and the data allows us to assess our work, especially the teachers that are with the children all day, to be aware around how many words they're introducing a child to. And then it's also just a great thing for parents to see how many words or attempts even a baby is trying to make an adult to form words. So this is an initiative that we adopted about 1.5 years ago. We've had great success with. Next slide. This is the curriculum that's in the works to be adapted in addition to the parents as teacher. The Healthy Families America, prenatal to 6 weeks, composed of 10 evidence-based bullets, prenatal supports, maternal and child health care, family goal planning, service planning, trusted support, relationship building, referrals, and many more. Next slide. And so here's just a noticing and wondering. I won't make anyone speak, but here is just a snapshot of some of the data in Washington, D.C., and it's by ward. And so I definitely wanted to include this in our presentation because sometimes it helps to get a visual. And here you can just see the infant mortality rates, how they differ across ward. And so here's just a noticing and wonderings that you can just do internally, what you see, and then you'll. Yeah. So I'll let you all just look at this for a few more seconds before I proceed. All right, next slide. The home-based services to pregnant women, right? So the DC or District of Columbia Child Fatality Review Committee, they continue to report findings showing that the infant mortality rates in DC, especially wards 5, 7, and 8, are alarmingly increasing. I would add that our families at Bright Beginnings, I would say 95% of our families reside in either Ward 5, 7, or 8, and we are housed in Ward 8, right across from Ballou. These studies also show several factors that are the reason for these mortality rates, which include either late or no prenatal care, lack of prenatal education, or little knowledge or access to resources. Which all in all means that most of these mortality cases could have been prevented. Next slide. Next slide. So here's a quick video that has a lot to do with the why we do what we do, and the initiative and the expansion that we're doing in our home visiting program.
In the district, a new study finds the capital is the most dangerous in the developed world, that is, to be born. Our Jeanette Reyes has more on the study and what's being done today to combat it.
Well, the numbers in this report are truly staggering. The infant mortality rate here in the district is a problem experts here are calling the tale of two cities. Babies in the poorest neighborhoods like Ward 8 are 10 times more likely to die before their first birthday than those in wealthier neighborhoods like Ward 3. Overall, 6.6 babies die per 1,000 live births in the district, making the U.S. capital the most dangerous city in the developed world to be born. This is according to the new study from the organization Save the Children. Progress has been made. The district has cut its infant mortality rate in half in the past 15 years, but experts say there's still a lot of work to do.
We've known in District of Columbia there's been a long-standing issue with higher rates of infant mortality among our black population versus that of our white population. And historically, it's just had higher than national average infant mortality rate overall.
And what it really means is babies and mothers, and we need to do something. At Children's National, we see that we can't do this type of thing alone. It takes partnership.
Now, the goal today was to acknowledge the significant role poverty plays in all of this and to coordinate efforts throughout the whole district to address this problem. Reporting in Southeast, Jeanette Reyes, ABC 7 News.
Given that, which the video is basically the reason why we're doing what we're doing. We see an issue in the city, and Bright Beginnings is excited and anxious to become one of the many powerhouses in the city to combat this issue. We decided, just like I spoke of earlier, with the self-sufficiency matrix, having cohorts in our home visiting program, our prenatal program, targeting teen moms, moms experiencing domestic violence, first-time moms, and moms over the age of 40. Next slide. Next slide. So here's just some statistics. I won't read over the entire thing, but just some things that stood out. When I first started to do the research around the mortality rates in DC, so the birth rate for teenagers ages 15 to 19 in DC is the 13th highest in the nation, which more than half of those wards being in wards 7 and 8. These wards, which are 93 and 94 African-American respectively, each represent approximately 15% of the city's female teenage population, but they account for more than half of all of the teenage births in the district. Next slide. First-time moms, approximately 70 to 80% of women will experience at minimum the baby blues. Most of these women, or many of these women, will experience something more severe, which we label as postpartum depression or a related condition. And so the reported rate of clinical postpartum depression among new mothers is between 10 and 20%. Next slide. Domestic violence is also a thing we know is a very serious issue in the city. And so one of the reasons why we wanted to have a cohort of moms experiencing domestic violence is because unfortunately, we see a correlation now higher with pregnancy and domestic violence. And so moms experiencing domestic violence in DC, 50% of women living in DC experience psychological aggression perpetrated by an intimate partner. 39% of women in DC experience either sexual violence, physical violence, and or stalking perpetrated by an intimate partner. These percentages, they're alarming, and we are anxious to do something about it. Next slide. Moms over 40. This is an age group that we felt kind of go under the radar at times. So we noticed in our programs, we did have some moms that were over 40. And so we wanted a special cohort to target these moms because we do know that there are some health risks attached to pregnancy for moms over 40. And so just some stats for you. The percentage of preterm live births among mothers over 40 is 15.6%, and that is significantly higher than the percentage of preterm live births among all other age groups. Next slide. So what we came up with was the idea of packages. Our home-based program has pregnant mom packages. And so listed here, as you see, under each cohort, teen mom, first-time moms, moms over 40, and moms experiencing domestic violence, a lot of the package offerings do overlap. Some of them have a little bit more things that might be specific to the need. For example, you might see more listed here under moms experiencing domestic violence because we kind of add in a child and family trauma therapy component to their packages, but all will receive a weekly home visit, lactation support, health and wellness supports, weekly diaper incentives, an amount of 100 diapers per week, doula supports, a program nurse, and a new baby care package. Next slide. And so I'll quickly go over these. So Bright Beginnings, we will provide, again, the home visitor that has been standing already. So the home visitor is a skilled worker coming into the home or wherever the family resides or consider home to implement the curriculum and provide mom with as much information, support, and resources as necessary. The curriculum is evidence-based, and these visits will happen once a week for 90 minutes with our program goal that 100% of our moms, our pregnant moms, will be educated on prenatal and postnatal child development. Next slide. We will have lactation support offerings, and that will happen twice a month. And of course, a lactation consultant is someone who assists women who are experiencing breastfeeding difficulties such as latching, painful nursing, and low milk production. A quick status that in a survey, the majority of participants, 76%, initiated breastfeeding. However, 31 exclusively breastfed in a hospital. And our program goal is that 100% of our moms are knowledgeable, at least. Of course, it's their choice, but knowledgeable about the benefits of breastfeeding and have access to a lactation consultant. Next slide. Dental visit. We know that it's a direct correlation of dental health and healthy pregnancy. And so we are offering a one-time no-cost dental visit that will be available to all pregnant moms with the purpose that moms are taking good care of their teeth and their gums during their pregnancy. We know that poor dental hygiene and gum disease can increase the risk of heart attack, stroke, and adverse pregnancy outcomes. Our program goal, again, 100% of our moms having an annual dental visit exam and connected to a permanent dental home. Next slide. Diaper support at the end of each month. So this has to be updated. So a little bit more background about myself. I'm a new mom myself. And so each week our families were receiving 50 diapers. And I found out firsthand that is just not enough. So I decided to up it, doubled it to 100 diapers per month as an incentive and support for our moms in our program, with the goal that all of our moms have sufficient supply of diapers to meet the needs of their newborn. Next slide. Doula support will be available, definitely optional. Of course, a doula is a trained professional that provides continuous physical, emotional, and informational support to a mother before, during, and shortly after childbirth. This is to help her achieve the healthiest, most satisfying experience possible. And our doula will be available for families twice a month. Next slide. Our home-based nurse. Our home-based nurse will come out bi-monthly, and their job will be to provide prenatal and postnatal health screenings for mom and the newborn. Next slide. And so programming, I talked a lot about programming overall, but I just wanted to give a quick glance of what programming looks like specific to our infant and prenatal program. And this can happen either Zoom or in person, but of course with participation at a lower amount. But we have things like prenatal yoga, breathing techniques for preparing for birth. And we know that prenatal yoga decreases back pain, nausea, and headaches, all of those crazy things that come with pregnancy. It increases strength and flexibility, the muscles needed for childbirth, improves sleep. It reduces stress and anxiety, and it just gives 30 minutes of moderate activity. For first-time moms, we have birthing classes, which would our first-time moms were understanding the stages and phases of labor coping and partner support, and in common medical interventions. Also for first-time moms, what to expect when you're expecting. We'll have programming focusing on their mental health, body changes, the importance of self-care, prenatal development, infant care and safety, safe sleep practices, all of that under that umbrella. Next slide. Teen moms. So because they are teen moms, many of our moms are still in school. And so we definitely want to offer programming that encourages them to continue going. Their life doesn't end at that moment. It's just started, and we are there as a support to help them reach their full potentials. And so programming around vision boarding and goal setting, obtaining their GED or completing high school, or even pursuing a trade or certification, and just navigating their resources in the city. Moms over 40 programming, parent support groups, understanding high-risk pregnancies, and understanding labor and delivery over the age or after age 40. Our moms experiencing domestic violence, we want them to completely understand what domestic violence look like, what are the red flags, programming around self-love, planning their escape, and really trying to narrow in and figure out who their support network is. Next slide. Next slide. So that completes our presentation. I will end with saying that Bright Beginnings, we see a need in the city, and we are going to be a powerhouse and a lighthouse in the city to combat it. The best way we know to do so is through our supports that we've done already, which is the in-person visits. Unfortunately, due to COVID, that was happening virtually, which is fine. Many of our families, they still continue to participate virtually. So that's definitely an option if you all know of anyone that can use our services. But what we envision and what we're doing is that these rates will slowly but surely start to decrease because our family will have the prenatal knowledge. They will have access to resources and they will be connected to quality healthcare. We know that that is an issue. It's a direct correlation between our Black and brown children or mothers and quality childcare or healthcare. And so we are doing the work. We're doing the groundwork and becoming an intervention and helping aid with the rates in DC for infant mortality. Alex, do you have anything to add?
Yeah, I can take some time to respond to the questions that are in the chat. And if there's any other questions, feel free to add them. So what are some of the child development concerns that the program focuses on? Do we serve children with special needs, with autism and the like? And what does the trauma therapy look like? And how do we determine children need it? So we do that through data. Bright Beginnings is a very data-focused agency. So we screen all of our children with the ACEs. The parents receive the ACEs screening, and then the Ages and Stages questionnaire, that's the ASQ, and the Ages and Stages questionnaire, social emotional. So that looks at social emotional skills, friendship skills, taking turns, patience, and the ASQ looks at communication, gross motor, fine motor, personal, social, and problem solving. So based on that, we're able to take parents' assessment of the kid and determine if they need extra services. The Brigance is administered by our teachers and home-based team, and that looks at children's cognitive abilities, as well as some of the overlapping fine motor, gross motor, visual motor skills. So depending on how the children are assessed, we're able to provide services in-house through the multidisciplinary team and coaching strategies with our teachers. Some of our children will need extra support. So at that point, we'll partner with the parents to try and create a referral for either in DC, it's early stages or strong start, depending on the age of the child, to get either early intervention services or special education services. So if children qualify for special education, they can choose to remain at Bright Beginnings, or they can choose to take a seat in DC Public Schools for one of the pre-K programs. And then the trauma therapy really depends on the trauma, and it depends on the family and the age of the child. So if it's a younger kid, trauma therapy is really going to be best geared towards attachment activities, trying to improve the parents' relationship with the children through attachment-based work. So playing together, art therapy together, where the parents are there, the kids are there, or we're providing parenting strategies so that the parents have all the tools that they need to parent their kids based on what the child needs. And then there is a little barrier with COVID right now, but there's hope that I'll be able to be in the classroom and helping teachers implement some social emotional skills using play and art-based techniques. So that is something I'm really excited about. I don't see any other questions. So I appreciate your attention and interest in this topic. And I will plug for Ebony that we are recruiting families. Any families in DC do qualify. We are ready to serve and really build this program. We also have spots right now in our center-based program. So it's all through one referral point to make it easy for you guys. And if there's any questions, how can our clients find support services within their region in this city? Do you want to take that one, Ebony? You see that?
Oh, yes, I see. Great question. So once you are linked with Bright Beginnings, whether that's center-based or home-based, our center-based families are connected with a family advocate, and our home-based families are connected with the home-based support worker, where they partner very closely with the families in providing and finding any of the services unique to the circumstance of the family. So, for example, if a family needs services around housing, food instability, even transportation. Their point of contact, whether it's the home-based support worker or the family advocate, will be directly working with the family on a constant basis to help locate those services in the city. And so, like Alex mentioned, we are ready to serve. We have openings in both our center-based program and our home-based program. Actually, on our next slide, see here our direct contact information. There's my email, and Alex's email is there as well. And we have no issue answering any lingering questions that you might have specific to any families that might have come to mind during this presentation. And then once speaking with them, or after we speak with you, we can pass information on to our enrollment coordinator, where they will talk with families on a more in-depth level of what the qualifications are and what's needed, and the next steps to go ahead and get enrolled into either program. But if that is all of the questions, Alex and I will end there. We appreciate your attention this afternoon. Again, we're super excited and passionate about the work that we do. We thank you all for having us to present here at this 2021 summit. We were very excited to do so. Please, we are accepting any referrals. Pass them along our way. This is just ultimately going to help this unfortunate, I would call it like a disaster in the city. I'm really, really attached to this issue around infant mortality rates. So I'm passionate, like I said, about this work. My team is passionate, and overall the organization, we know that we have to do something about it. And so we are grateful to be able to present today. And if there are no further questions, we're going to go ahead and end this presentation, and we look forward to receiving some referrals.